Hi, I'm Janice Fiamengo, and I'm pleased to be part of ICMI 21. My topic is going to be COVID-19 as a men's issue. And when I refer to COVID-19, I'm going to sometimes talk about the COVID project, the COVID phenomenon. I'm referring not to the virus itself, but to the various policies and messaging that developed with surprising uniformity across the Western world, that developed around it. So that's my topic. As everybody knows, this is the second year in a row that we haven't been able to gather in person to discuss men's issues. And whether we'll ever be able to gather again depends to a large extent on whether our governments will allow us to. And that's in a way my starting point. I'm going to argue that the COVID phenomenon is a men's issue, not ignoring the fact that, of course, it's a human issue, but I hope to show that it has affected men in particular ways and therefore deserves to be addressed as part of the liberatory project to resist the devaluing of men's lives in our societies and the limitations on men's life possibilities. I really doubt that it's an accident that government messaging and policies about COVID, especially in the Western world, have been so closely aligned with feminist ideology, elevating feminist values and dismissing masculine ones. In their essence, COVID policies have involved a startling expansion of the modern technocratic biosecurity state, one of the purposes of which is to remake all citizens, but especially dissident men, into docile bodies, docile beings, isolated, easily managed, and essentially socially impotent, incapable of providing for themselves or protecting their families without government permission and government assistance. The COVID-19 project makes it all but impossible for men to fulfill their primary needs as men, and I hope to define these as I go along. COVID-19 attacked masculinity in different ways, but perhaps most clearly by severing the link between male identity and men's chosen work. Governments across the world made it clear that men's work would continue only at the whim of our state masters, and those governments most clearly under the sway of feminist ideology also tended to be the ones most cavalier about suspending men's power to earn their living, sometimes for extended periods of time. Men who had built businesses over years were forced to sit idle and watch those businesses collapse because their governments had deemed them non-essential. The few who kept businesses open against state orders were arrested and fined, their businesses padlocked, while a compliant media consortium took pleasure in depicting them as a threat to public health. Christian pastors who kept their churches open against government orders were mocked, brutalized, and imprisoned. Those who won't take the COVID injections are being fired from their jobs. And of course, this is the case for women as well, but for various reasons that I hope to make clear, it is happening more to men and it matters differently to men because of the close relationship between male identity and work. Under the COVID regime, male identities based on active contribution to society have been replaced by compliance with ever-changing state orders and willingness to enforce such compliance on others. Enforcing COVID compliance has already become the job of many police officers, health practitioners, teachers, and government officials. It was obvious from the beginning of the pandemic that the media-approved consumer of COVID messaging was feminine. First and foremost, she was and still is very fearful. Her understanding of the risk that COVID presented was astronomically out of proportion to the actual threat, as presented in scientific findings of case fatality numbers. Her fear was mainly alleviated by following government orders to a T, wearing her mask, standing on the marks, and following the arrows placed for her in stores and offices, placed there by people she doesn't know and with whom she has no relationship, but whom she trusts implicitly. This media-approved COVID citizen doesn't question government information, even when it is self-contradictory and self-evidently contrary to common sense. She's ever on the lookout for threat and ready to report those who aren't as vigilant as she. She engages in COVID mass rituals, such as the nightly cheer for healthcare workers that went on for months. She puts COVID-related signage in her windows, pledging that we're all in this together. She has been given permission to rage against those whom she perceives to threaten her. Of course, I'm aware that there are quite a few men who fit this profile too, but I think you'll agree with me that it is essentially a feminized identity, one that values security above all. In everything that authorities and media said and did from the beginning of the pandemic, the COVID narrative was one in which female concerns, female suffering, female needs, these were always in the spotlight, with men represented variously as slackers or peripheral, or oppressors or threats. Even while reports were making clear that men were dying in far greater numbers from the virus. In the early days, the reports out of China and then out of Italy showed 70% of the fatalities to be male and 80% of admission to hospital acute care wards to be male. And these were staggering, terrifying reports. But even they didn't budge the narrative that our primary concern must be women. And as I'll show in a minute, men were even blamed for dying in greater numbers. I never once heard a public health authority anywhere say that it was horrifying that men were dying at such a high rate. I never once heard a discussion about women, what women could do to protect the men in their lives. I never once heard a discussion of men's particular needs and concerns. Before I get into some of the details of the COVID project's valorization of the feminine and demonization of the masculine, let me say a few words about what I mean when I refer to men's needs or masculine values. Obviously, this is a very big and complex subject, and I don't pretend that I'm going to be able to do it justice. But I can start with a simple definition drawn partly from the philosopher of masculinity, Jack Donovan, in his book, The Way of Men, which he published in 2012 and with various follow-up books. Donovan argues, and many others have agreed with him, that men in general need to be able to choose something to do that has value to their group and that represents their particular strength. Men need to define themselves by providing something of value, including or even especially providing something of value to other men. Men tend to seek status by being good at something, preferably something that requires a combination of strength, skill, risk-taking, boldness, hard work, self-reliance, rationality, and wisdom. Men compete with other men for recognition and for an honored place in their group. It may actually be that risk-taking is built into the DNA of men, according to research psychologist Roy F. Baumeister in his 2010 book, Is There Anything Good About Men? How Cultures Flourish by Exploiting Men. Throughout human history, he argues, men have had to strive and compete with other men in order to have the opportunity to pass on their genes. But men aren't merely competitive, as Baumeister shows. They also form cooperative associations with other men in order to create the complex and highly functioning societies that have allowed the human species to thrive. At their best, men are both competitive and cooperative, working together with other men who, like them, bring something of value to the group. At times of war and stress, when survival of the group is at issue or when group security is threatened, men traditionally fight against existential or external threats. They organize with other men to protect their families and each other, and they go out to meet the threat. They strategize about how to defeat it. They stand guard at their homes. But if COVID was a war, as it was sometimes represented as being, it was a war in which, notably, none of the masculine virtues of strength, skill, risk-taking, boldness, hard work, self-reliance, rationality, or wisdom was valued. Under COVID, boldness was recast. It was not only unnecessary or unwanted, it was actually recast as murderous recklessness. Risk-taking was recast as lethal stupidity, and fearful selfishness was recast as virtuous caring for others. During COVID, action of almost any sort was in general frowned upon, as was thinking for oneself, which was increasingly demonized. Citizens were exhorted to shelter in place, essentially to cower at home, waiting for the word that it was safe to come out. In some countries, citizens were actually monitored to prevent them from going too far or going out too often. Making decisions for oneself based on a rational calculation of risk and reward was forbidden by law in most cases. Not all men could stay at home, of course. There were the convenience store operators and the truckers and delivery men and repairmen and law enforcement officers and so on. But significantly, these men were almost never depicted in the mainstream media as heroic in their actions. Usually they were seen as part of a necessary but regrettable trade-off between maintaining some limited functioning of the society and stopping the virus, with that latter elevated to the status as the primary public good. Anyone who tried to suggest that maybe there were other public goods other than stopping the virus, those people were shamed and presented as enemies of the good, as a hysterical obsession with case numbers and risk and protection seemed to grip the entire world. There were some heroes of COVID-19, but they were almost never depicted as male. They were mostly the healthcare workers, the nurses. We were told they were the frontline workers. We were told over and over again that they were bearing the disproportionate burden of COVID, for which we were all exhorted to feel simultaneously grateful and guilty. The heroism of nurses, as depicted in the mainstream media, well, it was a peculiar kind of heroism, perhaps properly termed victim heroism. Some nurses didn't hesitate to complain about the risk to themselves in having to care for sick people. Some nurses quit their jobs quite publicly, citing the unacceptable danger. In Canada, thousands of elderly people died in long-term care homes, reportedly of COVID-19, but often actually of thirst and other neglect-related causes, because the predominantly female care home attendants and nurses wouldn't show up for work. Despite that, and following an inquest that revealed horrific dereliction of duty, no criminal charges will be laid. It seemed that none of nurses' expressions of fear, self-concern, or objection to risk, unheroic as these were, none of them were allowed to detract from their mandatory sanctification. It was also often noted with approval by commentators that many of the chief health authorities in various administrations were female. And we saw these women regularly on our television and computer screens. They were by turns stern and reassuring, expressing empathy for designated COVID victims and self-righteous disappointment in designated COVID dissenters. In my home province of British Columbia, Canada, the Chief Health Officer, Bonnie Henry, spoke each day on television to announce the numbers who had died or were sick. Her voice would quaver and the tears would gather in her eyes in an impressive display of emotional sensitivity, which seemed to be what the public craved and appreciated. These tears and quavers, perhaps justified in the public mind or merely distracted from the many others who were suffering and dying in the province, some as a direct result of the surgeries that had been canceled or other restrictions instituted, but for which no one ever publicly lamented. On one day in the late spring of 2021, Bonnie Henry spoke publicly of the idea of designating a BC Hug Day for those of us who were still waiting patiently some 16 months in for her permission to hug a friend or relative. That was only if we were very good and followed all her orders and took our COVID medication. The infantilization of the citizenry and the designation of the state as a stern but all-knowing mother could not have been made more evident. And I'll come back to this idea of the state as the all-knowing mother in a few minutes. For a while during the pandemic, it was also very popular to claim, as one academic study had found, that female leaders were more effective in preventing COVID deaths among their citizens. And even well after the shoddy research behind the study was exposed, the idea persisted that female, or at least feminized, leaders were better because they were more vigilant about the virus. They locked down more fanatically and they enforced obedience more totally, relentlessly demonizing anyone who resisted. In Canada, lockdown and other COVID policies killed far more people under the age of 65 than did COVID itself. This is well known. It's according to the government's own published data. But the fact has caused no outcry that I'm aware of, and it's made no seeming difference to the willingness of health authorities and politicians to pursue such policies. When men were the focus of COVID discussion, the emphasis was most often on the danger that they posed or on their weakness as men. And in a number of cases, men were actually blamed for their alleged weakness. There was an article, for example, in Al Jazeera in April of 2020, in which a female doctor wrote that men's unhealthy lifestyles were at least partly responsible for the more severe illness and higher mortality rate that they were experiencing. According to this doctor, Dr. Sarah Kayat, men were more likely to partake in unhealthy lifestyles such as excess drinking and smoking and not washing their hands properly. And even at the time, it was known that these factors weren't key to the impact of the virus, but that kind of article was quite common, that kind of sentiment. Around the same time, a writer for the New York Post took what seemed to me evident pleasure in explaining why women were better than men at defeating the coronavirus, and she highlighted men's greater genetic vulnerability to viral infection. Coming early in the pandemic, when the staggering numbers were hitting us out of Italy, for example, it was shocking, if not particularly surprising, to see the utter indifference of these commentators to men's suffering and death. Other opinion makers blamed men as so-called super spreaders who were allegedly indifferent or uncaring about the welfare of others. A BBC writer named Priya Ilan he made anti-male propaganda out of a study that found men slightly less likely than women, slightly less likely to wear a face mask if such coverings were not mandated. And this was all he needed to buttress a very predictable, quite vicious argument about toxic masculinity. Along the same lines, a writer for the Huffington Post named Richard Stokoe claimed that the white male was the biggest risk in spreading the virus. He was referring to research suggesting that white men, though also Hispanic men, which he quickly buried, that white men were in general least likely to take shelter during tornadoes or to leave flood areas. And from that, he came to the conclusion that during COVID-19, it means many won't stay home to save lives. It still remains to be seen, I think, whether staying home actually saved any lives at all, but that didn't stop Stokoe and others from pushing this kind of anti-male propaganda. In this case, the HuffPo author completely neglected to mention a rather significant difference between lack of concern or diminished concern for one's own safety and lack of concern for the safety of others. It's well known that the men who stay in disaster areas are staying there in order to protect property and to assist vulnerable others. But, this author was obviously looking for any reason at all to create a demonizing link between white men and virus danger. Now, for those of us who care about men's issues, and I could give many more examples of this sort of messaging, for those of us who care about men's issues, none of this was new or really surprising. We didn't actually expect that our news media would exhort women around the world to step up to protect the men in their lives. We didn't actually expect anyone in a position of prominence to express horror at male deaths. But perhaps some of us did expect that a new virus spreading around the world, wreaking havoc, well, that during that time, at least some aspects of the gender war might fade into the background. We thought we might hear less about male privilege and women's unfair emotional burden, given the circumstances, but we didn't. And in fact, as I want to end by arguing, the gender war actually ramped up, and the COVID state quickly came to exemplify what psychologist Jordan Peterson and others have described as the devouring mother archetype. So this isn't just authoritarianism, although it definitely is authoritarianism, but it's authoritarianism with a female pathogenic face or in a female pathogenic manner. The state as devouring mother is one that is protective to a destructive extent. The devouring mother state needs citizens to be utterly dependent, both physically and psychologically, and will make them so using emotional persuasion and manipulation, psychological sabotage, and force if necessary. To maintain and increase dependence, the COVID state quite deliberately isolates citizens from one another, and especially from sources of alternative meaning and strength by, for instance, closing down churches and other sources of spiritual nourishment, by limiting gatherings, by forbidding free and rational discussion, by deliberately fanning the flames of deep fear, by spreading stories of COVID sickness and death, by demonizing and scapegoating dissenters, by prohibiting protests, and by impairing collective traditions. The devouring mother state doesn't allow citizens to make any of their own decisions about risk and self-protection, and doesn't allow them to share information about medical treatments, for example. The devouring mother state binds citizens to her through displays of moral concern, lecturing us when we have disappointed her, sending us to our rooms for punishment, holding out rewards in return for our loyal compliance, and targeting the non-compliant as the cause of our collective misery. It is impossible for men to live as men when they take the moral meaning of their lives from a mother state who tells them what they have to do to please her, who lies to them about their situation and forces them to repeat those lies and act on them and shames them if they won't. It is bad for men when their only power is the power to police other men to be obedient to the mother state. Fortunately, there are now some signs of resistance to the devouring mother who has determined all our lives for the past nearly 2 years now. Amidst labor shortages and increasingly irrational bullying over vaccine mandates, we're starting to see this resistance. Doctors are starting to speak out about vaccine injuries. Protesters are refusing to back down, and groups of workers are finding their collective voice. We've got truckers, school bus drivers, transport security workers, pilots, firefighters, police officers, military personnel, and others daring employers to fire them and face the consequences. Alex Gutentag has recently described this as an emerging revolt of essential workers. That's the title of his article. And he tells about various work stoppages, class action lawsuits, mass retirements, and airplane grounding sick-outs that suggest a brewing backlash against the COVID compliance project. It's far too early, of course, to declare victory, but there are encouraging signs that mostly working men, though not exclusively, some working women too, are refusing to accept rule by an authoritarian overclass. Not all men can be or want to be warriors, leaders, builders, creators, rebels, or heroes. But a society that prevents men even from dreaming about the form their heroism might take, that denies them freedom and self-determination, is clearly not a society where anything good can flourish. It's the society feminists want for men, and COVID, to all our detriment, gave it the opportunity to take a great leap forward. I, for one, can only hope that the resistance continues to build.